that for intestinal suture we need two types of clamps. We need elastic intestinal clamp. This one cut, but could be straight. Absolutely not. There are no differences. Elastic is elastic, and the minimal traumatization of intestine. Main aim of this instrument just to close lumen to block leakage of intestinal contents during transection of intestine. You know that inside of intestine there are a lot of bacteria. That's why minimal leakage may cause later or local general peritonitis. And this one, crushing. Of course, they are full crushing, and it's necessary for what part of intestine during resection? What part we use? No,
It's close to
for the part for removal. Yes, for resection. Except this instrument, we have alternative instrument. There are Peyer's intestinal clamp. Peyer, it's the name of surgeon who described this shape and type. And Peyer described two types of instruments. This one, Peyer's intestinal clamp, it functions same as crushing intestinal, except this Peyer's prepared for us, Peyer's clamp for the stomach. Here, difference in presence of single tooth. It's forceps, it's clamp for the stomach. We use it during stomach resection for the crushing of the part of, and for clamping of part of stomach for its resection. Why there is present this element, blunt tooth? Because muscular wall, muscular layers in stomach, there are present a lot of layers, yes? In intestine, just one layer. And direction of muscular layers in stomach's wall different. That's why when you start cutting it doesn't mean by coagulation, by cautery, or by scalpel, muscular layers feel in pain, of course. And it doesn't mean that patients sleeping not feeling pain. The autonomic nervous system is still present. That's why during transection of stomach's wall, there could be non-controllable and wrong reaction, contraction of muscles. As a result, line of transection of muscles could be curved, not straight. And after that, suturing is difficult. Not enough material if somewhere was a large contraction. That's why, by this instrument, in single time, we closed all layers, catched, and fixed at the same layer. Peyer's clamp for the stomach. Next, for today, Ellis forceps. For anus peritonealis performing, for colostomy, for fixation for the clamping of peritoneum. I showed you this instrument when we talked about pleural cavity and operations on pleura. Ellis forceps. Scissors for enterotomy. They are special instrument, not general surgical instrument. It consists of, on back side, on back branch, olive-shaped bulb, and it's protect back wall of stomach or intestine from cutting. It's protected. You see, we can cut only structures in between branches, only here. This instrument, one more old instrument for you, the mechanical retractor. I showed you the same topic as Ellis forceps for the chest cavity, for thoracotomy, for laparotomy too. It's like mechanical hands. Next, Riverdine abdominal spatula. This is not a hook, this is not a spatula for dislocation of organs. This spatula is for pressing of organs. It helps protect abdominal organs, mainly intestine, when surgeon closing abdominal wound, laparotomic wound. We use large and sharp needles, and under front abdominal wall, a lot of loops of intestine. Intestine, very active organ. And because of peristaltics, it can move under the needle, and we can do puncture. Any one puncture of intestine, potentially it's a place for infection, yes, for contamination. That's why, to protect organs, assistant take it and press it down to protect. And in case of mistake, needle, we can drop it only to this surface. Next, one more retractor, here mechanical, here abdominal retractor. Function, retraction, dilation of operative wound. Now group of instruments for parenchymal organs. First of all, this one. The oval-shaped window, this forceps head, and its shape same as the shape of organ for the clamping. What is the name? How do you think? First idea, a lot of students think that it's for testis, yeah? But it's for gallbladder, and there are forceps for gallbladder. Now you're smiling, yeah? But this semester when we control notice, next semester, half of students who have this instrument talking about testis and clamping of testis. I don't know, the bad dream, as I think. Next forceps with V-shape opening between branches. There are forceps for the tail of pancreas. Function, clamping, and resection of tail of pancreas. And group of instruments for revision and for cleaning of anhepatic bile ducts. If there are gallstones in anhepatic bile ducts and mechanical jaundice. First one, for revision of patency and to check lumen of anhepatic bile ducts. Here, olive probe. We put it through bile ducts, proximally, distally, and check patency and in any direction. If this, we have different directions, just one example. But let's see, colors of all instruments are not same as color of instruments here, because they are steel, they are surgical steel, absolutely strong material. This one, elastic, they are special metal, not steel, special metal. It's elastic, that's why individually for each patient we can little change shape of this part as necessary for the patient. And the olive probe, when we found somewhere stone and stone blocked lumen, we can use a loop to take it out if stone is large, or hook, same way, hold it and remove. Or if patient have a lot of small stones and stones mixed with inflamed bile, in this situation it's like a gel-shaped structure. This gel we can remove from anhepatic bile ducts with the help of spoon, and we clean it. Spoon for anhepatic bile ducts. That's all. There are a group of instruments for abdominal surgery. Of course, number of instruments very large, but we're talking about basic instruments. Next, what we will do now, I will explain you on, as I said, on next class or on last class, not one of the last class, 15th class. We will discuss instruments and how we'll do it. I will give you for each of you about 5-6 instruments, as general as special. You should know the name of instrument and its function. Function, it could be or directly for example for the scalpel, cutting of the transection of tissues, yes, or for special instruments for revealing abdominal spatula, protection of abdominal organs during suturing of abdominal wound. Its function. Or example of operation. Function during cholecystectomy. This is how we will work. Now, you remember each class I showed you some instruments, special instruments, from